Hi, everybody, and welcome to Trifecta. Tammy Bruce here, along with your favorites, Bill Whittle and Stephen Green. I have the pleasure of sitting in for the fabulous and vacationing Scott Ott. Now, since October 1st, when the ironically named Affordable Care Act officially launched with the online healthcare exchange, the recent news coverage has been about the lies told to the American people about keeping your health insurance policy, and now even whether or not you'll be able to keep your doctor and hospital. The American people know those details and have been appropriately appalled. An administration lying to the American people is indeed a serious issue. But something even more shocking is at the core of what Obama and the Democrats have done. Consider this comment from Obama healthcare advisor Ezekiel Emanuel.
Isn't it a fact, sir, that most, in fact, of the Obamacare health plans that are being offered on the exchanges exclude a number of doctors and hospitals to lower costs?
The president never said you were going to have unlimited choice of any doctor in the country you want to go. Let me just finish.
Wait, no. He asked a question. If you like your doctor, you can keep your doctor. Did he not say that, sir?
He didn't say you can have unlimited choice.
It's a simple yes or no question. Did he say if you like your doctor, you can keep your doctor?
Yes, but look, if you want to pay more for an insurance company that covers your doctor, you can do that. This is a matter of choice. We know in all sorts of places you pay more for a wider range of choices or a wider range of benefits. The issue isn't the selective networks. People keep saying, oh, the problem is you're going to have a selective network.
Well, if you lose your doctor or you lose your hospital.
Let me just say something. People are going to have a choice as to whether they want to pay a certain amount for a selective network or pay more for a broader network.
Which will mean your premiums will probably go up.
They get that choice. That's a choice we always make.
Which means your premium may go up over what you were paying. So that, in other words...
No one guaranteed you that your premium wouldn't increase. Premiums have been going up.
The president guaranteed me I could keep my doctor.
Under president, and if you want to, you can pay for it.
Wow, I don't know. You only really have a choice about spending that kind of money if you have an extra $5 or $10 grand laying around. I know I don't. Now, there are only 1 or 2 Obamacare plans that offer a wide choice and access to the more supposedly elite doctors and medical centers. And they are, of course, the most expensive plans, truly out of reach of the average middle-class family. In other words, with Obamacare, only the rich will have access to the best doctors and hospitals in the nation, along with genuine medical choice and easier access and more rapid care. Liberals and conservatives alike now must ask, why has the Obama administration created a system that makes the best quality health care available only for the 1%? For legislation that was pitched as something that would even out the playing field, we seem to have gotten the opposite and something much more sinister. Now, Steve, these hospitals and doctors that are available now only in the high-price plans are more expensive because, in part, they're providing the most cutting-edge, ergo, more expensive care. If America allows this effectively to unfold, what will be the result of rationing of the better doctors and hospitals to a chosen few?
Oh, well, you know what, this rationing, this chosen few, this 1%, that's the end game. That's what they're looking for. And this isn't just health care. I know the left loves to talk about equality, this, and democracy, that, but if you want real democracy, if you want real equality, you have to have free markets. And of course, the Affordable Care Act is the exact opposite of that. But every chance they get, and this is in every country in the world, and it goes back for all of human history, the rich and the powerful like to get together to put the squeeze on the rest of us. And they do that so that the rich can protect their wealth and the politicians can protect their power. Now, there's no bigger threat to the established order than some sharp kid with bright ideas starting a business in his parents' garage. So
Amen.
You got to suck the life out of his business with regulations. You got to suck his meager finances with mandated insurance. Whatever you do, you got to keep that kid, that Steve Jobs, out of his parents' garage and in his parents' basement watching, I don't know, Miley Cyrus, another Sound of Music remake. This is by design.
God help us. God help us with that. This is really the example of what the left ends up doing. And it also, if we allow ourselves to be pushed into this, it's also a psychological reinforcement, perhaps. It's meant to manipulate us into believing that we're not as good as the rest of them or as good as politicians bill. Pre-Obamacare, anybody who could pay a basic premium had the access to the same doctors and hospitals as everybody else, no matter who you were, who you are. You could get world-class care regardless of income, socioeconomic status, et cetera. You'd pay that premium. You'd walk into the same hospital world leaders have chosen for their care. By attempting to destroy this egalitarian system of the individual marketplace, what exactly do you think Obama's Democrats are trying to achieve?
There's so much to say here, so let me just go as quickly as I can. First of all, watching that interview just shocked me because it's just, isn't it just astonishing watching actual journalism just every now and then when an actual journalist asks pointed questions and won't let go, when he's actually calling a member of the administration or a representative of the administration out and say, but he said this, and then you hear the tap dance and the little unicycle act and the twirling umbrellas coming from Mr. Emanuel, and he just keeps pressing the point. Did the president say you could keep your doctor, yes or no? And what you end up with is this dissembling nonsense that if every American saw this guy trying to back his way out of what the president actually said, the president's approval ratings would be at 10% now. So there's that. Just the fact that that's actual journalism is interesting. I think the larger point, Tammy, of what you're saying is really, really important, because what you're saying is exactly right. This policy is designed to make sure that only the rich get the kind of health care that everybody used to be able to get. As you said on our conference call, if you could make the premiums, you could go to Cedars-Sinai, no matter who you were. Yeah. And the thing that I think has to be said here again and again and again, so that the American people don't ever forget it, that this is the end game of socialism everywhere it's been tried. This is the end game of progressivism. These people rise to power by ginning up people's emotions about income inequality and, oh, that guy's got more than you do. And what ends up happening is they come up with these giant programs that make sure that the masses, because that's what we are now, we're not citizens anymore, the masses go into this pool of crap, which is clinic health care for everybody except for the people who have the money to hire their own doctors. That Harvey Weinstein doesn't have to worry about going down to an Obamacare clinic. He's not going to have to sit at the DMV for 5 hours to get a checkup. Harvey Weinstein's going to have his own private physician who's going to come by his house, and that's how it works. Isn't that how it always works? Isn't it always true that it's Lenin and Stalin that have the dachas, and they have the cars, and they have the servants, and they have the banquets, and they have the feasts, while everybody else stands in line to get bread in the frozen snow? This is what they want. They want power, and their fig leaf for the personal power is, we're doing this for your own good. And the wheels are coming off, and everybody sees it.
Look, I think that both as conservatives, we know theoretically that socialism doesn't work. Historically, we see it has failed nations and destroyed them. And now as individuals, whether we be conservative or liberal, this is a really good example of the fact that leftists lie. And they tell you what you want to believe and what is the right thing, and then they go and do the opposite. Look, every day we get a new example of how the private marketplace is what allows us all to make the choices that best suit us as individuals. While we do need to make changes to the healthcare system to ensure more access, one thing we do know, when smug politicians and government bureaucrats get involved insisting we're here to help, we all lose. For Stephen Green and Bill Whittle, I'm Tammy Bruce. Thanks for watching, everybody.